Oh, okay. Well, actually, try hitting record on your end because right here it says, okay, there we go.
You got it?
Yes, we're good.
Okay. All right. Good morning, everybody. Thank you for joining me today to learn about what happens after you refer a case to SMP. It's going to be very exciting. So, of course, today I'm going to be talking about gathering information and, what happens pretty much after you refer a case to me. So, I've got a question first thing in the morning for you all. Which of the following is true about SMPs and complaints of Medicare fraud, errors, and abuse? A, when suspicious behaviors or charges are detected, SMP educate beneficiaries about how to report their complaint. B, when someone contacts the SMP with a complaint, SMP complex interaction specialists help them report complaints and assist them during the resolution process.
Okay.
C, SMP complex interactions include both cases of suspected error and cases of suspected fraud or abuse. Or D, SMP collect information and perform extensive research and determine how to proceed with each case they receive. Is one of these true? All of these true? What do you all think? Okay, I guess we have no takers this morning. So it is all of these. All of these are true. So this is what SMP does with complex interactions. So, of course, gathering information is the very first thing that I do. So when you actually refer a case to me, I ask very specific questions. I ask you to, gather as much information as you can. And why do I ask that? Is because I need detailed information. And this helps me gather whether it's a error or if this is actually fraud or abuse. So that's why we gather this information. And this is why I talk to the beneficiaries, get the beneficiaries information, get the complaint information. So what is the issue? I get the information on the subject, which is usually the doctor or durable medical equipment company, whoever that may be. And then I try to get any additional information that I can get, anything that helps with the case.
Expecting at 10:30.
Everyone, take a moment to make sure you're
Miriam Boutique.
Please and thank you. And actually, let me just pause, see if I can mute everyone. Lonnie, if you would unmute yourself, you can go back. Should be good.
Okay. All right. Hang on. Let me get back. Ooh. Come on. Oops. Sorry. Okay. So back to why I gather information. Can everybody hear me?
Yes, ma'am.
Okay. So why do I gather this information? I said it actually goes back to, is this an error or is this actually fraud and abuse? So that's why I gather as much information that I can get. Of course, the beneficiary's information, really what I need for the beneficiary information is, I have to have first name and last name. And we're talking about the first name and last name that is actually on their Medicare card. I have to have their Medicare number, date of birth, phone number, email, address. And we're talking about the address that they have on file with Social Security. Because if I have to call our Medicare backdoor number, they ask, and if I have to use my unique ID number, they ask this stuff. And if it doesn't, match, then they will not speak with me. So that's why I need accurate information, as much as we can get. Of course, I may have to, if you all don't gather that information up in the front end, that's why I really need the beneficiaries at least name and phone number so I can call them to get this information. And of course, I need the complaint information. This goes to, we're doing the who, what, when, where, and why kind of thing. We've got the who, that's the who is the beneficiary. What, this is, the complaint information. What is the issue that we're dealing with? Or if it's not the beneficiary, we need the information of the caregiver or whoever else is the other complainant. It could be a family member, it could be some power of attorney, legal guardian, something like that. So we need that information also. So that's the who and the and so the next thing is the subject information. This is the subject information is the physician, supplier, whoever it might be that the complaint is against. So I need as much information as you can about that subject. So name, address, phone number, anything like that is very helpful, because I have to remember, I have to enter this into SERS. Or, any information off the bills. If they got bills, anything, we can get all this information usually off of those. Any additional information that we've gotten, if they file an appeal, if I can get a copy of the appeal or anything like that, any documentation, anything like that that could be related to the case, doctor's notes, anything like that is very helpful. Really what I need additional information, mainly if we're dealing with fraud, I need a copy of their Medicare summary notice or their explanation of benefits. If they have a, supplement, I need a copy of where the supplement is paid. So that EOB or anything like that. So anything where it looks like Medicare has paid or the, Advantage plans has paid, I need a copy of that. If there's any bills is very helpful. Anything like that related to the case. So this is why I have to do the who, what, when, where, and why kind. So this is some questions that I really need answered. If you all can answer them beforehand, before you get the referral to me, better, because you actually see them face to face. Most of the time I don't. If you don't, just gather as much information as you can. So I can actually answer these questions. Of course, who is the beneficiary or the complainant? The subject, of course, your name. Any insurance information, anything like that is very helpful. So next question to answer is what? What is the issue? In detail, explain, me what the issue might be. For example, if Medicare, did pay this claim, and then, for example, this is a QMB, and then the beneficiary is getting billed for that, 20%. Just explain it like that. Beneficiary, Medicare paid their part. Beneficiary is QMB, therefore, and here's the bill that the provider is trying to charge the beneficiary. Something like, just in detail if you can. The more detail, the better. Here's some more questions. Date. I need dates. Where did this occur? Of course, the provider's name, or any documents, anything like that. What actions have you or the beneficiary already taken? For example, have you already called the doctor's office and said, hey, this beneficiary is a QMB, you should not be balance billing them? If the beneficiary is called, I need, all of the steps pretty much that they have already taken. That way I can go back in saying, okay, well, when I send out my little nasty letters, especially if they're QMB, explaining, okay, the beneficiary contacted the doctor's office on this date. The volunteer contacted the doctor's office on this date and explained that, both of the beneficiaries QMB, yet you're still balance billing them. You are violating federal law by balance billing them. So anything like that. So any steps that the beneficiary or you as a volunteer have already taken is very helpful when, especially if you're, you've already tried whatever you have already tried, helps me on the back end. because that way I can go ahead and say, well, we've already tried all these and nothing has been corrected. So tips on documentation, this is some of the stuff that I try to gather if we can. If you are there with the beneficiary and they have that, documents, try to get a copy if you can. I tell beneficiaries that a lot of them don't have copiers or can't copy. I usually tell them that ask them if is it okay if they send me the documents, or if we can go copy them right now. Anything like that. Some of them will send the documents to me and I will copy them and then send them the originals back. So either way, I really need a copy of it. If you got a scanner, one of those little big portable scanners, if you could scan it, or anything to get me the documents that are required, really helps the case. Of course, as I said, with me having my Medicare, backdoor number or unique ID number, SMP has different, we have some special set, like, all the ship volunteers. If you have a unique ID, you have special access to Medicare information, and you have to use your Medicare ID. With some of the Advantage plans, some of them won't talk to you and some of them will. Don't forget, we've got the SMP release of information. So if I need to send that out to any of you all, please let me know. I can email that out. It really helps to get that release of information signed. That way it gives us, sometimes gives us better access, especially if it's a Advantage plan or something like that, or with providers. Some of the providers won't talk to you unless you have like a release of information. You can just send that to them. So if you can get a release signed in the front end, that really helps getting access to talking to providers and things like that. So keep that in mind also. Also, MSN and EOBs, if you can get copies of those, it really, really helps a lot. This explains, there's a lot of information on those, date of the service, what was actually billed, it has usually the numbers for the service, the name of the service. So anything like that way I can know if it was billed correctly or if they, didn't code it correctly. So it's got all the codes and stuff like that on it. It just really helps. It's got the, provider's name and information. So it really helps, especially if it's for a service that was referred by another physician. So we've actually got that physician's name, like some of the braces, especially the brace scam, it'll have the referring physician's name on there. So, and we know, then I can go back and ask that beneficiary, well, have you ever seen or talked to this physician or whoever that referred these braces to you? And most of them were like, no, I've never heard that name before. So that way I can go in and research that doctor's name and find out where that doctor is and things like that. So any information is very helpful. And of course, I have to, enter all this into SIRS. So that's why I ask for a lot of information. I even have to upload the documents like the MSNs and stuff like that. So, so there's actually, required fields that I have to have in order to submit a referral to the OIG or anything like that. So, name, date of birth, Medicare number, OIG really needs all this information, especially if I'm referring it on for fraud. Subject information. I cannot refer it onto the OIG if there is not any subject information. Or pretty much anywhere. I have to have a subject. And one, like Mary or Sam or, Mr. Smith is not going to cut it. I have to have specific information. So in order for me to write good case notes, because I have to do a case note, and there's specific things that I have to have in these case notes. So that's why I have to have a lot of these questions answered. I have to have the who, what, when, where, and why answered before I can actually type up my case notes. And these are a crucial aspect of the case because this is what the OIG reads. And also have to word stuff so it can grab the attention of the investigators. So that's why I have to word stuff specifically, especially especially some of the goes back to patient harm. If I can prove patient harm or anything like that, then that catches the investigator's eyes very easily. So I have to be specific on my wording so that they can actually look at it and then run with it. And of course, with my case notes, this helps decide on if it's an error or fraud or abuse. And most of the time, I don't actually, if it's an error, for example, a billing issue. For example, I helped Amanda with a case yesterday. She was speaking to a beneficiary, and she was getting billed, even though she has Medicare and Medicaid, she's QMB. She was still getting billed for the service completely. And when Amanda called Medicare could not find the claim at all, where the provider had submitted it to Medicare. Well, come to find out, in their claim to Medicare, they had actually put the wrong Medicare number in there. So that's why it was not showing up on the beneficiary's claims from Medicare, because they had put the wrong Medicare number in. So of course that is an error. Luckily, Amanda got the provider to correct it yesterday, so they resubmitted the claim to Medicare. So that's an actual error, and these do happen all the time. Coding issues. As I said, they forgot. They mixed up the Medicare number for the beneficiary, so the claim never got correctly submitted to Medicare. Things like that happen all the time. It's where providers are most of the time willing to correct those errors. It's where they get, if you get a provider that is unwilling to do that, that's when, or if there's a pattern of errors, like if we continue seeing this same provider, like I had this one provider that kept balance billing beneficiary, and we're talking multiple times with the same beneficiary sometimes. And so, this was after me, talking to them several over a period of years. I finally said that was enough. I've had enough. This is a pattern of errors that I keep seeing from this one provider. So I actually referred them onto OIG for fraud and abuse. So if we're seeing a pattern of errors, then we can go ahead and refer it on to the OIG. So here's some questions, to consider that always, helps me with, sending the stuff on. Has the beneficiary tried to reach out to the provider? Have they contacted? What has the beneficiary done at all? Or if they just brought you the bill and they haven't done anything at all. What documentation is the issue does the beneficiary have ready to share? For example, do they have the MSN, bill, anything like that? If they don't, ask them to go back and get that for you or find it for you. Sometimes they've thrown them away, because I just talked to a beneficiary yesterday who actually threw her MSN away for the braces, a box of braces she received that she never ordered. So now I'm having to go back and order an MSN for her. So that's one thing that we can actually do with our unique ID. If we have all their information, we can call Medicare and say, okay, she actually remembered the name of the company, so that was good. So I can actually call Medicare and say, okay, I'm needing a copy of the MSN from this certain provider for, back brace or whatever, and we can order the MSN. So sometimes we have to do that. Or you can call the provider's office and get a copy of the bill sent to the beneficiary, anything like that. Another thing, does it seem like it might be a billing error that the provider can correct with Medicare, another payer, or the beneficiary? So that's, that's the thing. That's what we did yesterday with Amanda. She helped get that corrected. Is a provider who participates in Medicare unwilling to bill according to Medicare rules? And if that is happening, then that's something that, we can educate the provider. Hey, you're billing this incorrectly. For example, the QMBs. If they're willing to fix that, then good. If not, then that's when I have to turn it over to the OIG and let them do their thing. Does the provider's behavior seem particularly, far outside the realm of possible error? So that's when I probably need to go ahead and proceed with, the fraud. Depends on what the provider says to you. And I have this sometimes happen all the time. Well, that's how we're supposed to do it, or that's how we've always been doing it, or something like that. If that happens, then I just go ahead and submit it for a fraud referral. And of course, I tell beneficiaries, don't sign a blank of anything. Another thing that I look out for, have I received other complaints from this same provider? I can always go back and check. Another, was a claim denied or rejected? Did the beneficiary sign an ABN? And I always tell beneficiaries, do not sign a blank one of these if you can. Of course, here, if they did sign an ABN, you may have to help them, file an appeal. Or if Medicare denied it, then it's something that you may have to help them file an appeal for. Here lately, it seems like I've had several ambulances where they've been denied, I guess. And most of them, the last one we were dealing with is that something about the doctor forgot to sign something. So the ambulance company was working with the doctor to see if they could get the paperwork or something from the doctors stating medical necessity, pretty much is what it was, so they can resubmit that to Medicare. It always helps if the provider can submit anything else to go along with their claim, because they can always pull it back and resubmit the stuff to Medicare easier than it is for a beneficiary to actually file an appeal. So it's easier for a provider to file an appeal than it is for a beneficiary. So of course, once we gather all this information, what happens next? So of course, if we find out it's an error, so what do we do with that? Always call the provider first if we can. So I work with the provider first to see if they can resolve the error. And that's with Amanda. I was walking Amanda through it yesterday, and she had to do several calls. She had to call Medicare a couple times. She had to call the provider a couple times. But we worked through it. The provider looked at the claim that they sent to Medicare and finally figured out that they submitted the wrong Medicare number. So that's why it never got paid. So of course, they pulled back that claim and corrected it and resubmitted it to Medicare. So it's easier if providers are willing to do stuff like that. Sometimes if we can get the beneficiaries to actually call a provider, sometimes beneficiaries have a better relationship, especially if it's a primary care physician, one that they've been seeing for years. If we get the beneficiary or the complainant to actually call the provider themselves, to try that first before we ever try going through the other steps for the you as the volunteer or me trying to get those. If we can get the volunteer to do that first, then that way we have more leverage. Of course, tell the beneficiary or the complainant, to call you back to let you know what happened either way. Did they solve it? If not, that way that we can go on up the steps if we have to. And of course, if you think it's a pattern, like you've dealt with this provider numerous times with these types of errors or something like that, please pass that information on to me so that I can get them, escalated up to a fraud and abuse referral. So of course, here's some steps for the beneficiaries, for resolving. This is for errors. 1, contact the provider. Another thing, if they have an Advantage plan, I sometimes tell them to contact the Advantage plans because the Advantage plans guy should contact that provider and say, hey, something's messed up. We never got the claim, or, you coded this incorrectly. Sometimes the Advantage plans are really good at working through that. So either contact the provider, contact the Advantage plan, or if it's a prescription drug issue, definitely contact their prescription drug plan. to see if they can correct the issue. Of course, if none of that helps, definitely contact me and give me as much information as you can if you cannot get it resolved. Of course, this is steps for the SMP. I pretty much do the same steps that the beneficiary does. I try contacting the provider. I try contacting 1-800-MEDICARE. I pretty much do the same steps. If I cannot get the issue resolved, that's when I pass it on to the higher ups, pretty much. That's where I refer it on if I can't get something done. Of course, if I do get it done, then I, just do all my documentation and I close my case. That's if I can get it corrected. If not, then it goes on up the chain. So that's the error. So how do you build a case for referrals? And the case means pretty much fraud and abuse referrals. Same way, I have to have a lot of information. And why I keep harping on case notes is because I have to be specific on what I put in there. Because the OIG can only take 2,000 characters when we do a case to OIG. Their portal only takes 2,000 characters. So that's why I have to be very specific and on my wording when I do a case note and it's going to the OIG. So pretty much I have to have the data, info, complaint info, that sort of thing. The plan, with the assessment, what happened, subject, others involved, any attachments, anything like that, and the plan. And I'll show you what my template actually looks like here in a second. So here's actually what my guided narrative template looks like. This is what my case notes actually look like. I have to have the data, beneficiaries information, the assessment, the complainant stated, that's pretty much what happened, provider information, and I have to have, explain specifically if there's any others involved, any attachments, and then the plan pretty much, what's going to happen after, this step. SMP referred it to OIG hotline, I referred this to CMS regional or, something like that, whatever happened after I typed up these notes and where did it go to. Sometimes it goes to several different. So this is what my case notes actually look like. And this is just a template. This is not, but pretty much it's data, assessment, plan, and that's my notes. And they actually did this for us, so it's really easy to fill in the blank kind of thing. So of course, it'll start out with SMP representative. That could be me or you. It depends. Spoke with, who did we talk to? The date of the interaction. Complaint information, relationship, was this a daughter, POA, whoever it might be, the beneficiary, and I have to have their information, and the plan is on, they're on, original Medicare, they're on, and here's their Medicare number, or they're on an Advantage plan, whatever, and here's their, Advantage plan number, anything like that, address, phone number, stuff like that, because I have to put that in the case notes. And then, complaint states that I have to explain the interaction or incident in full sentences. So I have to, I have to be specific. And of course, this is the most crucial part of critical part of the narrative is actually what happened, So that's why I have to be in detail as much as I can. Attachments, that's, MSNs, EOBs, bills, emails, anything and everything. Like I even had one type out a, timeline for me of, they called the doctor's office on this date and this is what happened. I mean, I even included that in the attachments. So anything and everything that we can put in there is helpful. Bills, any correspondences from the doctors or the providers or anything and everything that we can get, I attach in there. Any database searches, things like that, anything and everything. So of course, and then the next thing is the plan. You know, what does SMP plan to do? You know, like I have referred the case to the OIG or, you know, anything like that. So that's pretty much my plan. So what happens after that? So what happens after I, you know, type out everything and anything and everything? It depends. And now I've got another question for you. Which of these are national partners that work with SMPs to stop fraud, errors, and abuse? Who do you think it is that works with me to stop? And I've said this several times already. Okay, it's the OIG. And actually, CMS actually helps a lot also. So there's actually two. But sometimes all of these can play a role in helping stop fraud, errors, and abuse. ACL is because that's who my grant is with. Sometimes CMS contacts the FBI. So it could be, you know, either one of these at one time. But most of the time, my fraud referrals go to the OIG. So who actually can help with suspected error? Now, who can actually help with suspected error is the ones that is CMS, because it's Medicare that you can call, use your unique ID. That's the ones that can actually help with suspected error. That way, you know, we don't have to send it to fraud if the provider can work and can help with that, or if Medicare can. Now, here's my referrals flow chart. It depends on what type of referral it is. You know, did it depends on the Medicare program. Was it a Part A or B claim? So most of those go to the OIG hotline via the ACL. And also I can refer it to my CMS. I have actually a contact in CMS. They're actually in Atlanta that I can actually refer those to also. So I do both. I usually send them a fax, and I actually in my SIRS I click send to OIG. Part C, I refer to the OIG hotline, and also do send it to my CMS counterpart in Atlanta. Medigap claims, I actually, if there's fraud involving, you know, the Medigap or the supplements, I actually send that to the Tennessee Department of Commerce and Insurance. Any Medicaid claims, which is here in the state is called TennCare, I refer those to the OIG, and I actually send those to the TennCare fraud agency too, because TennCare actually has their TennCare actually has their own fraud unit that I actually send them to. Compromised Medicare number, I tell beneficiaries if their Medicare number has been compromised, and that's been happening a lot here lately because of the scams. They've gotten phone calls where they're, you know, have given out their number. I tell them to call 1-800-Medicare, and they actually have to call and request a new number themselves. DemiPose marketing violations, I refer that to OIG. Part C and D marketing violations, I refer that to my CMS counterpart in Atlanta. Quality of care issues, if we get any calls regarding quality of care, I refer them to the KIPRO in the state. It's the Medicare contractor that handles the quality of care issues is called KIPRO. So I refer them to KIPRO. So that's their Beneficiary and Family Center Care Quality Improvement Organization. In this state is KIPRO. And I can also give them, refer them to the state licensing boards or the state long-term care ombudsman, especially if it's dealing with a nursing facility or something like that. Consumer scams, it depends on what it is. course, you know, if it's that Social Security scam, I usually refer them to the Social Security Administration to report that. If it's the IRS scam, I usually refer them to the IRS scam, because I can only deal with the Medicare scams. And that's if the, you know, caller has called, claimed to be from Medicare, or, you know, anything like that, getting Medicare numbers, anything like that. If it's dealing with those other type of scams, I have to refer them either to, you know, those federal agencies or the FTC. I tell them to report it to the FTC, also the Federal Trade Commission. So I give them those numbers. So here's some common beneficiary and SMP actions. Of course, you know, I'm harping on this. If it's an error, you know, contact the provider. Compromised Medicare number, you know, contact 100 Medicare. I said before, if it's a compromised Social Security number, I tell them to call Social Security Administration and report it to the FTC or the FCC, both, the Federal Communications Commission. I tell them to report it to all three if they can. Quality of care, I said, you know, we do that to the KIPRO. And if the issue is resolved, you know, definitely, you know, let me know. If you resolved it yourself being a volunteer, please make sure that, you know, when you document that in STARS, that you hit send to SMP. Or if you have any other information that I need to attach to that, please let me know, you know, so that I can go ahead and attach whatever may need to be. Because once you put it in STARS and then you have a reference number, send me that reference number and any documents or whatever that I can upload those documents also to attach to that same referral. It just gives you credit, you know, for, you know, what the work that you've done. So I want to give you all credit for that if you actually have helped resolve something. Of course, you know, with SMP, you know, I can give guidance on where to refer a case. That's, you know, if you want to handle it yourself, give you some pointers. If not, then, you know, definitely send me the information. And of course, the last two is pretty much, you know, selecting and insert. That's pretty much what I input the stuff in SERS. So you all don't have to worry about that. So now I'm going to talk about some scenarios. So come on, people, y'all going to have to interact with me, okay? Okay? Okay, the first scenario, a beneficiary calls you because he noticed several claims on his MSN for braces, but he doesn't remember receiving any braces. He is very worried because the MSN states that he would be responsible for part of the cost, and it totals over $1,000. Okay, so of course the fraud. What kind of fraud do you think this might be? Oh, come on, people! It's a Thursday. It's not Monday. Anybody? Or they might not be able to unmute themselves. Okay, you might not be able to unmute yourself. But okay, so the type of fraud, this is actually would be fraud because the beneficiary, you know, doesn't remember receiving any braces. So if the beneficiary never received them, and this goes to durable medical equipment fraud. This goes to that brace scam. Most of the time, the brace scams that I've dealt with, the beneficiaries actually received a box of braces in the mail. That either their physician didn't order, they don't know who in the world it came from, or how they even got it. But that's what the scam that's been going on. So what I would need from this beneficiary, or if you're talking to this beneficiary, I need a copy of that MSN and any information off that MSN. Another good question to ask a beneficiary: did you ever receive a call from someone claiming to be from Medicare, talking about back pain, or said that they were going to send you braces or anything like that? You know, when was that call? If they can remember when it is, anything, even a month. You know, they received one in March or whatever. Anything like that is very helpful. That way I can get all that information. or if they've even got a bill, if they've gotten a bill from this durable medical equipment company. Anything and everything would be helpful for this, but mainly I would need a copy of the Medicare summary notice. The second scenario, a beneficiary is at a local health fair when she comes across a booth doing free cancer screenings for people on Medicare. She gives her contact information to receive more information, but does not take a test. Later, she receives an MSN saying she was charged for several genetic tests. And of course, this is that genetic testing scam. So again, I would need a copy of the Medicare summary notice, and anything else that if she gathered up any information during any of that information, the name of the provider, name of if she got any cards at that booth, if she got any information from that booth, brochures, anything and everything that I can get that she picked up that day would be very helpful, so that I can pass on everything to the OIG. Third scenario, a beneficiary calls because he just received a bill from his doctor for a service that Medicare denied. However, his MSN states that his responsibility is zero. So, what do you think this is? This is not really fraud. This is more like an error. So somehow the doctor's office did not get that claim back from Medicare that states that it was paid. So what I would tell the beneficiaries to do is call the provider, or if you can, go up to the provider's office and show them the Medicare summary notice that states that they're not responsible for anything. It's zero. That way, maybe the doctor's office can clear that up. Maybe somehow their two systems or something wasn't talking or something. Who knows what might have happened. But the MSN is showing that his responsibility is zero. Even though Medicare may have denied it, his responsibility is zero. So the provider has to do whatever they've got to do to get that cleared up. Now, if the provider's not willing to correct that or do whatever, so I would need a copy of the bill and a copy of the Medicare summary notice so that I can send it to OIG as a fraud complaint, because then the provider is trying to get money out of a beneficiary, even though they're not entitled to that. Scenario number 4. The beneficiary received a call from their Medigap plan offering additional benefits. The beneficiary said no, but later found out they were switched to a Medicare Advantage plan without their permission. Oh boy. I've actually been doing kind of something like this, but it's not, the Medigap plan was not calling. I've had other Medicare Advantage plans calling and switching beneficiaries without their permission. Now, this would not be a marketing violation because, it's their current Medigap plan, unless this would be a enrollment type of violation, where they've done something that they're not supposed to, especially enrolling a beneficiary without their permission, especially switching them to an MA plan without their permission, because they're not supposed to do that at all, because you can't have a Medigap plan and an MA plan at the same time. So please, pass these on to me. So this is definitely something that needs reported. And where I actually report these to is if it's anything dealing with MA plans, is enrollment issues. I submit those to CMS to have CMS, and most of the time I can get them switched back to what they originally had, because I've had to do that several different times with several different beneficiaries to get them switched back to you know, what they originally had. It's like they never had that MA plan in the first place. But I need to get those as timely as possible. So if you're dealing with anything like that, you might be able to call Medicare and use your Medicare ID number, your unique ID number, talk to Medicare, and Medicare can submit the complaint, or, you know, I can submit the complaint to CMS. Either way, if I'm not available and it's needed in a hurry, please go ahead and use your Medicare unique ID number if you have one, so you can submit the claim. So Medicare can submit the complaint to CMS. So of course, here's some of the, you know, going through the marketing guidelines. You all have seen a lot of these. You know, they can't go door to door to sell. They're not supposed to cold call beneficiaries if they're not on that, if they're not a current client of that plan. I definitely, you know, look at these right before open enrollment, because these start before open enrollment. And here lately, they have actually been continuing even after the Medicare Advantage plan open enrollment. I've had several beneficiaries that got changed to a Advantage plan, most of the time from another Advantage plan, without their permission, even after March 31st. And they did not have LIS. They weren't going, they haven't moved. They did not go into a nursing facility. I don't know how whoever it was that they spoke with got them changed. But obviously they lied on that application, because they have to have, you know, certain criteria in order for them to change to a different Advantage plan. That is not during open enrollment. Either of the open enrollments, either, you know, October 15th through December 7th, or the Medicare Advantage plan open enrollment, which is January 1st through March 31st. This was after those time periods. So please, if any of this is happening, please let me know. Get as much information as you can from that caller. Who are they calling? What's their name, their full name? What company are they calling from? Anything and everything. Their phone number that they were calling from. Is there another phone number that you can call? You know, anything and everything is very helpful. So what happens after I refer something to, you know, whoever I might refer it to? Of course, you know, so what's next? Referrals to CMS or referrals to the OIG? So what happens to referrals that I refer to CMS? CMS actually receives a secure email or a fax from me. I pretty much fax them. I print off the PDF from CSRS. That's what I pretty much fax them. And so CMS reviews the case, and they assign it to someone that they actually assign a case number to that, to that claim. And then sometimes workers actually call me, sometimes they don't. Sometimes, you know, CMS will not let me know what, you know, if it's gotten corrected or not. So it really depends on, you know, what happens with it, stuff like that. So pretty much once I pass it on, I may not hear, like, they may have switched somebody back without me knowing, and I don't find out that they've been switched back to their original Advantage plan until, like, the doctor's office calls me or something like that. So keep that in mind. Yeah, sometimes I don't even have contact people to call to check up on these. So what happens after I refer someone to the OIG? So pretty much what I do, I have to input everything in CSRS, and then I have to click a button that says send this to OIG via ACL. What it happens is ACL actually reviews that to see if there's something that can be worded differently, make sure that I have less than the 2,000, because if I don't have less than the 2,000, sometimes they can actually help me, you know, reword stuff so that I can get under that 2,000 characters. So ACL actually discusses the cases, if they have any other, you know, questions or something like that, and then ACL would deem the case ready, so that they will actually submit it to OIG. So ACL actually looks at the cases before they get submitted to OIG. But what they do, they look at them just to make sure that I've got everything in there that needs to do, or if we need to reword something or anything like that, ACL looks at that. Kind of like an extra set of eyes before we submit them to OIG, which is helpful sometimes. And sometimes they can help me with wording to beef up the wording, so that OIG will look at the case closer or anything like that. So it's really helpful, and they're really good to work with. So here's what it actually looks like for ACL to submit a case in the OIG portal. They pretty much have to take all of my information and cut and paste it into the OIG portal. So this is what ACL actually does. And down here where it says, complaint details, that's where I have to have that 2,000 characters. I have to have less than 2,000 characters. And let me tell you, some of these cases, it's very hard to get less than 2,000 characters because you can't explain everything fully. But sometimes you've got to be, and that's why ACL is really good. They can help me, cut things down if necessary. Take out all the, jibber jabber or something. So it's really, really good. But most of the time I can actually get under that 2,000 characters. So it's really good. So pretty much they have to take all of my information in SIRS and cut and paste it into this OIG portal. And then they, have to input any of the documents that I have to have. So they have to move them over. So now you know what the OIG portal looks like. Of course, the subject information and things like that has to be imported over. Everything has to be imported from SIRS into the OIG portal. So that's why we need as much specific information that we can get, especially about the subject, business name, anything like that. So, of course, once OIG receives the referral, it can be months or years before a complaint is entirely resolved. So keep that in mind. And I tell beneficiaries, one, I'm not the investigator. I'm just the one that gathers the information and then passes it on to OIG. I am not the investigator. So that's why I have to make sure that beneficiaries know I'm not the one investigating the case. I'm just the one gathering the information. And I have to explain to them that any outcomes is, of course, out of my control. Once I pass it to OIG, I may never hear anything about the complaint again. Sometimes I only hear resolutions to some of these as if it's from the news or anything like that. Like, providers gotten, charged or something like that. That way, that's the only results or status of a case that I would know, because OIG will not contact anyone about the results or the status of a case. And that is because then once OIG gets it and they open a case, it actually becomes an active investigation. So once it becomes an active investigation, in order to protect me and the beneficiary and whoever else may have been working on this case before OIG got it, that's to protect us. So that one, the provider doesn't know, who reported it or anything like that. So that's why I will never be contacted by OIG. The only reason OIG may contact me is if they have additional questions. But that's not to give me any results or the status of the case. So keep in mind OIG case evaluation factors. Law enforcement evaluation, becomes an investigation, So we've got the investigation phase, you got the prosecution phase, which actually can take forever. It depends on the type of allegation and the scope of the fraud. Sometimes these fraud schemes actually go, to different, so it encompasses multiple states. So that's why sometimes they have to get the Department of Justice involved or the FBI or, you know, something like that. So keep in mind with those factors. Of course, anything of this is out of the SMP control. So, of course, with the investigative priorities, you know, that's the OIG doing the investigation. We have to have sufficient resources. Priority case type, as I said, if we can do such as patient harm, well, you know, multi-agency task force involvement. You know, this is the Medicare Strike Task Force. It could be multiple agencies doing different things. And the methods of obtaining the evidence. You got to think, if this is a multi-state thing, there could be a lot of evidence that they have to obtain. Sometimes, as I said, it takes more. Sometimes the investigations take longer because it takes longer to get all that evidence. And of course, you know, the prosecutions can take forever because once all the investigation's done and all the evidence is gathered, then they've got to get, you know, the legal stuff, subpoenas, and, you know, all of that. So then they have to, you know, file the court documents to get them prosecuted, that sort of thing. So, and a lot of that depends on, you know, the trial schedule, the caseload of the judge. You know, when can they actually get it on the court dockets? All of that is definitely out of SMP control. So that's why I tell beneficiaries that, you know, once I send it on to OIG, I'm pretty much out of it. I don't know anything of what's going on, or I will never know of what's going on. So type of allegation, type of case type or allegation type, such as DME or billing for services not rendered. So identity of the subject or victims. So any information like that. Was there any previous cases or complaints? Use of a straw owner because of previous case or program exclusion. There are some providers out there that, even though they've been prosecuted before, they will go, you know, start another business under a pseudo name, or they'll use another relative's name for that, the owner, or anything like that. So sometimes, you know, you've seen different businesses, one business name, and then the other name is, you know, working as, or other names for the business. It just gets very complicated sometimes. And of course, the case complexities, you know, cybercrime involved, was it a criminal enterprise, anything like that. Dealing with, you know, fraud schemes, we're dealing with financial exposure. Not always a factor, especially in patient harm matters. So if it's dealing with patient harm, duration of the scheme, how long has this scheme been taking place? If this is over multiple years, it could take forever for them to gather all the information. Was there multiple subjects? Is there multiple victims? You know, it just takes forever to gather all that information. Are we dealing with someone local? We're dealing with someone national. We're dealing with someone international. Especially international is very hard because then you got to get all the international people involved. Multiple programs affected. Of course, you know, was it just Medicare? Was it Medicaid involved? Was VA involved? You know, was private insurance involved? Was supplements? I mean, it's you know, how many different programs was involved? Because if there was multiple programs involved, then, you know, it could take years to gather all that information. Other, you know, case evaluation factors. Funding. Do they have enough investigators? Waste and abuse matters, you know, copay waivers, adverse effects, insurance schemes, existing or prior exclusions. Other things is merits of the case. Is the case referral timely, complete, and accurate? That's another big thing. And that's why I need to get as much information as I can to make sure that it's a timely referral, make sure it's a complete referral, and make sure we've got as much accurate information that we can gather at that time. So that's why I tell beneficiaries and volunteers when I do their training that it can be months or years before a complaint is entirely resolved. Complaints that are referred to law enforcement will no longer, to resolve them, complaints addressed by CMS through administrative action. So keep in mind, if something's referred for law enforcement. So the more complex the case is, the longer it's probably going to take to resolve. Of course, we may or may not, most of the time it is not, I'll just go ahead and tell you that we may not be alerted to a final resolution at all. And of course, our impact can be is make sure that, I said we go back to that, make sure we're submitting quality referrals and make sure we're checking off those who, what, when, where, and why boxes. And I tell beneficiaries, you know, it's out of, once I submit it to OIG, then it is completely out of my control. So, you know, sometimes I said it can take years for these cases to get prosecuted. So most of the time, you know, if it's something like an error that I have resolved, then I can go ahead and close my case. Sometimes I've had cases open for years, especially for dealing with the complex, you know, the complexes, the brace scams and that sort of thing, the actual fraud ones. I've had open for years. So here's some resources if you all just want to read up more on some more of this, you know, complex interactions, because that's pretty much, I deal with the complex interactions. That's pretty much the fraud and error cases, the ones that, you know, you all don't feel comfortable handling or anything like that. You know, if you want some more training on this, there's different trainings that are already in the SMP Resource Center. You know, one of them is building a case webinar. One of them is where to refer webinar. The next one is using SIRS to make and document your referral webinar, but that's pretty much what, you know, most of you all don't have access to SIRS. But it would help, you know, help document, if you want to help document, you know, it'll tell what we need to document. So here's some of the other referrals. And there's really a lot of, like, there's guided narratives and stuff like that, all in the SMP Resource Center, which is really handy. And of course, you know, most of y'all have seen that Foundations training manual. SMP actually has a counselor training manual. We have a complex interactions training manual, and then we have a complex interaction job aid. That's for SIRS. That's just pretty much walking you through what you've got to put in SIRS. So I'm pretty much done with my presentation. Do we have any questions? Can you open it up? Can you unmute everybody so they can ask questions?
Sure can. Give me just one moment.
And I'm going to put my information up so that you all can see my information if you all need. Most of you have my information or know how to contact me.
Yeah.
But just in case. And I want to thank you all for joining me today. I hope it will help with you all if you're doing any counseling or anything like that.
Thank you.
Thank you all. Do you have any questions? Anybody have any questions?
I'm not seeing.
Carol has her hand up. I just wanted to thank you. Great presentation.
Oh, you're welcome. Thank you, Carol.
And we had a question from Luciano about providing a copy of the PowerPoint. I will send out a copy of the PowerPoint shortly, probably either end of day today to tomorrow.
Are you gonna, may I ask if you're gonna send it out to everybody that's attending right now?
As I will send it out to everyone who registered. If you didn't register, can you put your email in the chat so I can make sure to include you?
I'm not sure if I registered or not. That's the
It's fine.
problem.
Go ahead and put your email in the
there.
chat. Mhm.
Okay.
All right, everyone. That is all that we have today. Let me stop the recording.
Yeah, stop the recording. Somebody may not, and I need to stop